we are going to talk about labor, and labor is the process through which the fetus and the placental membranes and the amniotic fluid are expelled via the birth canal, that is the vagina canal, after 28 weeks of gestation. So before 28 weeks of gestation, it is not labor. It could be an abortion. So labor can be abnormal or normal. Our main aim of this presentation is on normal labor. But before we do that, first, we are going to talk about abnormal labor just a little bit so that we can have a clear insight of what this normal labor is. So labor can be normal, and also labor can be abnormal. Now, what is this abnormal labor? Of course, we know that abnormal labor can either be prolonged Now, prolonged labor in plant gravida, it is the labor which exceeds 24 hours. It is not supposed to go beyond 24 hours. It is supposed to be within the range. But in plant gravida, you find that the labor takes for more than 24 hours. And that is prolonged labor. It is abnormal labor. So that is in plant gravida. But in multi gravida, that is women who have experienced pregnancy, who have given birth before, it exceeds 16 hours. That is still prolonged labor. That is abnormal labor. So 16 hours in plant gravida, lasting for more than 16 hours in plant gravida, lasting for more than 24 hours in this plant gravida, women experiencing pregnancy for the first time. And also, as well as being prolonged, abnormal labor can be premature. Premature simply means preterm. Premature and preterm are exactly the same thing. So it can be short. And this is labor lasting, or maybe labor occurring in less than 30 weeks, 30 weeks of gestational period. Less than 30 to 36 weeks, sorry. So this is preterm labor or premature labor occurring in less than 36 weeks of gestational period. So that's our normal labor. There we have our abnormal labor. Now we want to talk about our main talk for today, which is normal labor. What is it that is normal labor? Of course, we have defined labor as the process by which the fetus and the placental membranes and the placenta and the amniotic fluids are expelled via the birth canal. That is after 28 weeks of gestation. That is labor. Now, what is normal labor? Well, normal labor is defined in simple terms as the process through which the fetus is born at term. The key word is term, not preterm, not post-term, but term. The process through which the fetus is born at term and presents by vertex position vertex or cephalic presentation, and is spontaneous within 28 within 18 hours. 18 hours, and it has no complications to either both the mother and the fetus. So that is our normal labor. So normal labor is supposed to present in vertex presentation. It is also supposed to be within 18 hours. It's supposed to be completed within 18 hours, and it is not supposed to have complications to either both the mother or the fetus. As well as that, it is supposed to be at term. Term being over 40 weeks of gestational period. That is 9 months exactly. That is our normal labor. Now, what are the causes of labor? What causes labor? Well, there are a lot of different factors that regulate the onset of labor. And the first one on our list that we're going to talk about is the hormonal influence. Now, the obvious hormone to start with is we'll start with fetal cortisol. So these are the causes of labor. The causes being the hormones. So we are going to start with cortisol. What role does cortisol play on the initiation of this labor? Well, in the late stages of pregnancy, the cortisol released from the adrenal glands of the fetus are going to stimulate the production of what we call prostaglandins. And once the prostaglandins are stimulated, they are released in the bloodstream. They also have a better role to play in this contraction of the uterine muscles. So fetal cortisol plays a better role in initiation of labor, being the reason that it produces or it stimulates the production of these prostaglandins to certain factors, which is going to cause the contraction of the uterus. So very, very important. And this fetal cortisol is being produced by the fetus in the late stages of pregnancy. And the other hormone to consider is progesterone. So progesterone is going to decrease towards the end of pregnancy. And the decreased production in progesterone is going to cause the uterine muscles to start contracting. Because we learned that in the earliest stages of pregnancy, progesterone is going to be produced in excess. And once progesterone is produced in excess, it's going to cause the uterine muscles to relax instead of contracting, to relax. That's why we term progesterone as the pregnant women, because it's going to be maintaining the pregnancy by relaxing the muscles of the myometrium not to contract. So once it drops, then uterine contractions is going to be initiated. That's what progesterone is all about. And as well as progesterone, there is another hormone called the relaxing hormone. Relaxing hormone favors the production of prostaglandins, for example, prostaglandin E2. In the earliest stages of pregnancy, This relaxing hormone will inhibit the production of prostaglandin E2, but during the late stages of pregnancy towards term, the relaxin hormone is going to favor the production of prostaglandin E2, and of course we know that prostaglandins plays a better role in the initiation of labor during these uterine contractions. So once this is done, then we are going to have these vigorous uterine contractions, and that's pushing the baby towards the pelvic cavity, towards the pelvis, so that it can be expelled. Relaxing hormone. And as well as that, what relaxing hormone does is that it relaxes, together with progesterone, it relaxes the myometrial muscles, the myometria, during the process of pregnancy, so that it does not contract vigorously, and that is going to cause the pregnancy to be maintained. Relaxing hormone. There is also another hormone, oxytocin. So as progesterone decreases, oxytocin increases, and oxytocin is well known for contraction. This is the hormone that is going to cause uterine contraction. And contractions of the uterus, we all know that it's going to bring about the birth of the baby. And as well as that, having talked about relaxing hormone being the hormone relaxing the muscles of the myometrium, it also plays a greater role in the ripening of the cervix. So the cervix is supposed to be dilated, supposed to be soft, it's supposed to ripen in order to prepare for the baby to pass through. So relaxing hormone does that. It's this relaxing hormone towards the end of pregnancy. Oxytocin is going to cause uterine contractions. And having talked about hormones, we now talk about the mechanical factors. Now, mechanical factors could either be overstretching of the uterus due to overgrowth. So under mechanical factors, we are going to have overstretching. And of course, when the uterus overstretches, then that's going to stimulate some certain areas of the brain to start producing hormones such as oxytocin, that is the hypothalamus, and then it will cause contraction of the uterus that will bring about the birth of the baby. So under mechanical, because an overstretching of the uterus is due to the hormone estrogen. And towards the end of pregnancy, this hormone begins to drop also, and that will bring about the overstretching of the uterus to stop. The uterus will not grow anymore because the estrogen, which was stimulating the growth of the maternal uterus, has dropped. Now, the other factors, the other mechanical factors could be febrile conditions. So febrile conditions, for example, malaria, the things which are causing fever, they act as a irritant to the uterus, and that will bring about contraction of the uterus. Once the uterus is stressed, or once the uterus is irritated by these febrile conditions, then that will bring about the contraction of the uterus. That's why malaria in pregnancy is not good, because malaria can bring about the preterm contractions of the uterus, and that will bring about the preterm baby, that is abnormal labor. We don't want abnormal labor, we want the baby to be born at term. So not to be born at preterm but at term. But because of these febrile conditions which act as irritants to the uterus, it will bring about the contractions of the labor even before we reach term. So very, very important that women who presenting with fever or malaria in pregnancy should be taken care of before any conditions or any dangers can arise to this woman. And the other thing is increased activity. So there's going to be increased activity of the uterus as a result of increased productions in hormone. So for example, the baby is moving, the baby are trying to engage itself through the pelvis. Those are some of the mechanical changes which are going to bring about this labor. Now, we're going to talk about the signs of labor. What are the signs and symptoms of labor? Well, the signs and symptoms of labor are divided into two. There is what we call true signs and false signs. In this case, we are going to start with false signs. And the false signs occur at about 2 to 3 weeks before true labor begins. Two to 3 weeks before labor begins. And what are these false signs of pregnancy? The first one is lightening. And lightening is defined as the descendant of the fetus towards the pelvic cavity. It begins to descend, to come down towards the pelvic cavity. That is before labor. But when you see it's going to start descending whilst the cervical OS is still closed, there is no mucus plug, which is the sign of true labor, but the fetus begins to descend down towards the pelvic cavity. And this is very good because it's going to cause the diaphragm to relax and the woman will breathe even better. But again, at the same time, it is bad because it is going to be in the pelvic cavity, thereby causing irritation or maybe some little bit of a backache as a result of this descended fetus down the pelvic cavity before labor, and the woman may have difficulty walking. So this can bring about some certain conditions. For example, it can bring about pressure, venous stasis in the lower cavities, thereby causing edema down the lower uterine cavities. So it is very, very important that we notice this one. And of course, this happens as a result of the softened pelvic ligaments, and the symphysis pubis is going to soften. So that's in order to accommodate for the baby to pass through. So these are just false signs. Again, as well as that, there's going to be what we call Braxton-Hicks contractions. So the Braxton-Hicks contractions are there because these are painful. They are non-painful contractions which are there since the time of pregnancy started. The Braxton-Hicks contractions. So we have accounted for lightening, Braxton 6 contractions, and the next thing that is going to be there is that the woman who have a frequent ejaculation as a result of the distended fetus or uterus down in the pelvic cavity, thereby pushing or pressuring the bladder, which is down, and this will cause the woman to urinate frequently, because as we can see, the uterus is just here, and the bladder is just down there. So the glowing uterus, the glowing fetus will put that pressure on the bladder, and the bladder will always want to be emptied as a result of the pressure that is exerted. Also, there's going to be sudden burst of energy. So some women experience this sudden burst of women. What we tend to do is we tell women not to be overexerted over this energy burst, because this can bring about loss of energy during labor. So we tell them in prenatal activities, prenatal visits, we tend to tell these women not to be overexerted over this sudden burst of energy, because we want them to conceive a certain amount for the labor. Now, we want to talk about the true signs of labor. So in true signs of labor, there's going to be show. There's going to be presence of show. Now show is the mucoid bloody stent. So for example, imagine this is the cervix. Down here, this is the cervix. There's going to be a plug here, which is going to be formed as a result of estrogen. For example, this is going to prevent ascending infection from coming in. So this is the vagina, vaginal opening. And this is the cervix. So what happens is that in the earliest stages of pregnancy, there's going to be an increase in amount of estrogen. Estrogen is going to cause this mucous plug to close the cervix, so that it prevents ascending infection from going inside and have these certain effects on the fetus, growing fetus. But at the end of pregnancy, since estrogen has dropped in levels, then this thing, the plug, the operculum, it's called the operculum, of course, it's going to be plugged off, thereby allowing the cervix to begin dilating. This is what we call show. That same blood stained mucoid, it's called show. And also the cervix is going to be dilated. So there's going to be the dilatation of the cervix also as well. And this is as a result of the upward retraction of the muscles, the uterine muscles, pulling down the cervix. And as well as that, the cervix is going to be effaced. because effacement of the cervix is thinning of the cervix as it widens out, because the uterine muscles are going to be retracting the tissues of the cervix upward, and thereby causing the lumen of the cervix to widen, and then it retracts thereby. So these are the true signs of labor. In the next talk, we are going to talk about the stages of labor.